Welcome back to class. I'm Coach Terry. Let's see what we'll be learning today.
Today we're talking about AI in your health, what it can do, where it can go wrong, and how to get better answers. Let's hit the class.
So yes, AI is very, like it says, impressive. But as we know, nothing is perfect, nothing is. So we need to understand the limitations that AI has so we can use it a little better. That's what Timmy's from, your registered dietitian, your pharmacist, trusted health person. So again, that's why you guys can run stuff has AI and then bring it to us and ask us what we think, right? As well, we can help confirm yay and nay because we're trained on certain things that we know that you might not know. You ask AI and we can let that, okay, that's right, that sounds about right. So just, yes, it can make mistakes. AI can say things that they think is right, and it might be incorrect. So especially in research, you have to double check. I noticed, so if it says back in 1637, there was a war between the cows and the pigs. Well, you might want to double check, is that the correct year? And what I do is I run it between 2 or 3 AIs. And so I'll put it in Claude and ChatGPT. And another one, Gemini, and boom. And then just run it on the internet, right? Now that's correct, right? You got 3 different resources. Outdated information. AI training has a cutoff date and may not reflect the latest guidelines. And that happened to me when I went and spoke in Atlanta. So I had my presentation ready because I had just presented for the health department a couple of months ago, and it said it was 97 million people with pre-diabetes. That's what AI said. I checked it. I have a whole presentation. Luckily, the night before I was going to present, we were setting up and we were just having general discussions. I get in my little frustrated mood. I said, I can't believe I was a coach that has 97 million people, and 10 years ago, it was 66 million people. They were like, no, fast is moving. Less than a year ago, it was 97 million people with pre-diabetes. Never seen it move that fast. And it's pretty scary, but it's like everything in America. A lot of stuff's scary when they just move slow motion like it's no problem. You be like, oh, I'm getting murdered. It's okay. It's normal. Everybody's overweight. Oh, that's okay. It's normal. It's America for you. AI doesn't know your complete history, medications, and lifestyle. And that's what we're going to talk about, how you get acquainted with your AI to make sure it knows things about you and to make sure everything is good. All right, so what's the secret to getting great answers when it comes to AI? It's called garbage in, garbage out. And the more specific your questions are with your prompts, the more better and an answer you're going to get. So if you use like a vague prompt, like give me a meal plan, then this is gonna give you a meal plan. I don't know nothing about you. I don't know if you eat Asian food or Ethiopian food. You just said, give me a meal plan, right? So we gotta be more specific and give it a better prompt. So a better prompt would be, I am a 62-year-old woman with pre-diabetes, high blood pressure, and arthritis. I have a $100 grocery budget. Please create a 7-day meal plan with simple recipes. And so these specific details that you're telling it is going to lead to more personalized. See how different from the vague prompt to the better prompt? So you see how you can get better information by more information. All right, so some teaching points it gives you include your age, your health condition, your budget, your preferences, and your goal every time you ask a health-related question, because a 60-year-old person is going to have different health needs in relation to 33. Even ethnicity I would throw in there because, example, if you're an African-American person, you're higher risk for blood pressure than a white person. So throw in your ethnicity, throw in your age, even heck, throw in where you live, because the people in public health, my 2 public health people can tell you, and they should know this, Coach Timmy and Coach Ezekiel, but your zip code can determine your living, how long you live. Okay, your zip code can determine your life expectancy. That's real talk. Research shows that. So, of course, if you live in high inner city type violent areas, which I just found out today, example, African-American male is, and so then that person living in maybe a South Side zip code is going to have higher, not only violence, but maybe blood pressure and a heart disease and a whole bunch of whatever that area, lower socioeconomic. So yes, your zip code does determine how you live. All right, so those are some things. The better information you give it, the better your prompt will be, your answer.
If this video opened your eyes, please hit the subscribe button. Also, you can click the link below if you're ready for real structured help. and not just another headline. On that note, that's it for class, and we'll see you next time.